late deafened adults, which is what the two of you, Donna and Paula, are, there is insufficient attention paid to training and teaching about how to make best use of the implants. Sigrid, you've complained about that many times, that for older recipients of cochlear implants, the audiologists don't go out of their way to tell them all the ways in which they can use additional technology to maximize the use of their implants. So, Sigrid, have you had any thoughts at all about improving that situation?
I'm not sure what works in the professional field, but my personal observation is that if you have not undergone an implant yourself, you may have a very abstract approach to fitting a patient. And it's usually, in my case, it's been go into the clinic, get a test, an audiology test, and goodbye. So we will fit your implant according to your test. It has nothing to do with real life out there. How do you cope with X, Y, and Z? Oh, there are so many ways you can do it, but these things are never, ever mentioned in the clinic.
So I'd like to make an observation about Sigrid's approach to adapting to her cochlear implants. She insisted on making herself listen. So when she got those 520 books on tape, it was to make herself listen. When she got the new implant, after the implant failed and we got the new one in 2019, she insisted on listening to television by not looking at it. She faced away from the television to make herself listen to the sound. Now, not everyone is disciplined enough to do that, but it's an important point that your brain actually will help you if you let it do that. And so one thing that we discovered from her newest implant is that we never remapped it. It started with the old map from the previous implant. And her brain adapted better than anything the engineers could do by changing the cochlear implant processor map. Her brain adapted to the incoming sound to the point where she started to enjoy music and all the other things that she mentioned. So those are lessons that I wish we could capture and share, because so many audiologists don't know about these things.
You never mapped it again, just once?
That's right. We never changed it. We didn't bother because we discovered that her brain was adapting to the input sound better than any kind of mapping tricks that you could play. And so this is a huge lesson about the adaptability of the brain. There's a word for this, I've forgotten. The plasticity of the brain is super impressive. And so we should pay attention to that and take advantage of it. I have one other point to make, and that is that when we were up in New York, getting Sigrid fitted with her new implant, the audiologists had never met anyone who used auxiliary equipment as intensely as Sigrid does. They had no idea that patch cords were useful. We had to go out of our way to get little microphones on cable properly configured for the implant, which turned out to be a non-standard thing. But they were just completely oblivious to this. So most of the implant users were being told, oh, you can hide this under your hair and nobody needs to know that you're wearing a cochlear implant. And of course, Sigrid's reaction to this is, are you nuts? I'm going to use every possible thing to capture every available decibel. So, buzz off.